Hi, I'm Dr. Kumiko, Doctor of Physical Therapy and violinist. In this video, we're going to review the posterior forearm, but make sure you go and watch the anterior forearm video to make sure you're up to speed for part 2. As a review, the anterior forearm had a story going about passing and failing some tests in your anatomy course and improving your grades from a B to an A. In the posterior compartment, we're going to continue on our studying journey, but now we're going to dive a little bit deeper into excellent learning and superior learning, and I will tell you more about what this means in the next few moments. But first, I wanted to introduce you to Brett. This is Brett, and he's going to help us remember some of the names of the muscles in the posterior forearm. Similar to the anterior forearm, the posterior side has 2 layers. There's the superficial layer, and then there's the deep layer. Both of these layers have a number of muscles in them that I need you to remember. The superficial layer has 6 muscles, and the deep layer has 5. So if you remember from the last video, in the anterior forearm, you ended up with an A grade in the course. To maintain your A grade, you had to continue to study with excellence. Most of the muscles here in the posterior forearm are meant to help you extend. E is for extension of the wrist and the hand. The first muscle in the posterior compartment is the anconeus muscle. This represents the A, for the A grade that you currently have and you're trying to maintain. The rest of the muscles start with the letter E. So I'm going to give you a mnemonic to help you remember these. So the mnemonic I like to use is let Brett DM you. So Brett here is going to slide you a DM to help you memorize all of these muscles. Here we go. So let's take out your forearm. Use your opposite hand as a reference. You're going to place it on top of your forearm. Each of these fingers represents a different muscle in the superficial layer. Let Brett DM you. The first muscle, let, stands for extensor carpi radialis longus. The second one, Brett, stands for extensor carpi radialis brevis. Both of these muscles are on the radial bone, which is why they have radius in them. The third one is D for DM. That muscle is the extensor digitorum. The M stands for extensor digiti minimi, going towards your pinky digiti minimi finger. And then the last one is U, and that stands for the extensor carpi ulnaris. And this muscle goes along your ulna. Next, let's move on to the deep layer. This layer consists of 5 muscles. So you got an A in the course. You want to study excellently so that you can continue to have superior outcomes. The S in the next layer is standing for the supinator. The next 3 muscles after the supinator are actually known as the anatomical snuffbox. These muscles are the abductor pollicis longus, the extensor pollicis brevis, and the extensor pollicis longus. So you can remember this as the brevis is in between the 2 longus. And I'm going to show you an up-close view of what these structures look like and where it is in your hand. Take a look at your own hand to see, move your thumb up and down. You can see those tendons popping up. The anatomical snuff box is important as a clinician because it can help you quickly find a bone called the scaphoid bone right in between those 2 tendon locations. And the final muscle in the deep layer is the extensor indicis, which represents you being number 1 in your class because you did a good job memorizing all of the muscles of the posterior forearm. And a fun fact for you guys, all of the muscles in the posterior forearm are actually innervated by the radial nerve. I hope that this video was helpful. Make sure to click the link below for your study sheet and memorization sheet. I will also be putting up a QR code here so that you can scan it to follow along in this video or to use later on during your study time. Don't forget to check out the YouTube shorts on the forearm. Brett has a cameo appearance in all of them. Happy studying.